Periodontal disease has many treatments, and the treatment depends upon the extent of the disease. In the early stages of periodontal disease, treatment may include cleanings, basically removing debris above the gum line and below the gum line.
We really have a whole new way of treating periodontal disease that was never available to us until just recently. And we've changed our whole perio program both here in Tri-Cities, and it's always exciting when you're doing something new and it's the best ever for both the patient and for the health of the patient, and also exciting because you're doing something new that's really beneficial for the patient.
Some of the solutions that we provide here at our practice for bleeding gums would include either a cleaning by our dental hygienist. That cleaning oftentimes uses the perioscopy, where we can see beneath the gum line and we can see the bacteria and remove any deposits, bacterial deposits that are on the root surfaces.
One of the things that we do, which is I think very unique, there are very few offices that do this, is we use a device called the perioscope. And the perioscope is like an endoscope, or a little camera that enters the space between the tooth and gums around the teeth, and can actually act as a camera to show us all of the debris that's accumulated below the gum line. When hygienists clean teeth, they're doing it blindly. They're doing it by feel because they can't see down into those pockets. This perioscope allows us to see the debris and to be much more effective in removing it. And so therefore we can control the disease process, where with regular cleanings at your dentist, that wouldn't necessarily be the case.
And the way we treat periodontal disease is, after we do the cleaning, we give people time to heal. And if, again, their pockets are small and they don't bleed and they're healthy, we don't have to do any more, and they could just come back for regular cleaning. Of course, the patient has to be a good maintainer of their own mouth, doing great oral hygiene and coming back regularly. But if, in spite of their best efforts and our best efforts with this perioscopy, the infection remains, we now have this unbelievable tool, our new laser technology that we use for surgery. So it's been about 1.5 years since I've ever cut a gum for the gum disease, because the results I'm getting now, placing a laser into the pocket and letting it do its magic, we now get people healthier than they've ever been without any of the side effects that we used to have with the old surgery.
What's typical for laser gum therapy is the patient comes in and we can perform the treatment in 1 hour to 2 hours, and it may take either 1 session or 2. Following the treatment, it's very important that the patient acts as a co-therapist. What that really means is that they come into our office and they're seen by our dental hygienist every 3 months, so that we're really able to monitor how well they respond to the treatment. That's the important part of it all, is that we maintain them and we check up on them and we see how well they're doing, so that if they slip at all, we're there to catch them. We're there to make sure that their investment is a sound investment and they get healthy.